Hi, my name is Deni. I'm going to be doing my checkoff, my last and final checkoff for this class. I'm currently in Honduras on a medical mission trip, and we will be utilizing my material that we have from the doctors that I are on the trip with. And what I do not have, I will verbalize and speak as if I do. Okay. Hello, my name is Deni Townsend. I'm going to be your nurse practitioner today. I'm currently washing my hands before and after. We are going to be inspecting, percussing, palpating, auscultating, so that involves us moving you around and putting you in different positions and touching you. So if you feel uncomfortable at any time, please let me know. Also, if you have any questions. Okay. All my supplies. Oh yes, all my equipment is intact. So I'm gonna start off with the exam by asking you what your name is.
Yes, ma'am. My name is Jorge.
Okay.
And my birthday is 02/04/1982. I'm 32 years of age.
Okay, good deal. And what do you do for a job?
I'm a janitor.
Okay. And what brings you in today?
So I'm having a little bit of a sore throat that's been going on.
Okay, and how long has it been going on?
So about 7 days, comes and goes. Feels like it's burning, and it gets better with a little bit of Tylenol.
Okay. Have you ever had your tonsils removed before?
When I was a kid, yes, ma'am.
Okay. And how often do you usually get like strep throat or?
When I was a kid, maybe 2 or 3 times, and amoxicillin really helped me out.
Have you been around anyone with strep throat recently?
I think my brother's kid.
Okay.
But that was also maybe 7 days ago.
Okay. He's alert and oriented ×4. I'm also going to give you a series of numbers to remember that I'll ask you at the end of the exam. Okay,
yes,
it's 1, 2, and 3.
Yes, ma'am. Okay.
Okay. I'll come back and I'll inspect your throat here in just a little bit, but I'm going to go ahead and do a full body inspection on you. So if you feel uncomfortable at any time, just please ask. Okay.
Yes, ma'am, I understand.
No anxiousness noticed at this time. No visible deformities or lesions noted. That I can see at the time. Okay, so I'm going to go ahead and fill your scalp. Cephalic is noted and intact with no issues. The frontal sinuses, I am inspecting, palpating, and percussing. No issues noted there. I'm gonna move down to the maxillary as well, since I'm doing the sinuses. No noted issues there as well. And then I'm going to go ahead and inspect the eyes. I do not have the eye, I just went blank on what it's called. Is it the otoscope? No, the fundoscope? The eye thing? Oh, the ophthalmic scope. Sorry, my mind just went blank. So I'm going to utilize what I have. We're going to go ahead and check as if I had a light. And we're going to pretend. Pupils are reactive to light. Perla is intact. Pupil size is 3M with brisk reaction. No sclera is clear. No drainage or issues noted to the eyes bilaterally. We're going to do the cardinal sign. So I'm going to do my hand. I want you to follow my hand the way it goes, okay? I'm going to draw a box and then do an X to do the 6 fields of cardinal signs, okay? And then I'm going to cover your eye, and I want you to follow my hand, okay? And then here, we're going to go in, okay? Then we're going to go down, and we're going to visually look at the nose. Looks like there is no noted deformities or polyps out of the nose. It is moist and pink. If I had my light, I would be looking at the nostrils just to make sure. And we're gonna visibly look at the ears. There's no noted issues to the external part of the ears. And then we're going to look at them. Are you having any issues with your ears today?
No, ma'am.
Okay.
Might have a little bit of earwax, but no issues.
Okay. As I said, this is not working, so I'm going to utilize it as if it is. We're going to pull the ear up and back. And we're going to check. There is a gray, pearly, tympanic membrane with a 6 o'clock cone light. bilaterally. Did that hurt? I'm sorry.
No, you're good.
Okay. We're going to go ahead and we're going to feel thrill of the tympanic artery, and no noted issues at this time. I'm going to go ahead, I'm going to have you open up your mouth while I do it. No noted issues with TMJ at this time. We're going to feel the nodes of the periocular nodes, and then the postocular nodes, and then we're going to feel the occipital nodes along with the tonsillar nodes. Tonsillar nodes are swollen. Then the submandibular nodes noted with the segmental nodes. No issues noted at the time, but tonsillar nodes are swollen. Okay. Okay, go ahead and swallow. No, nothing is wrong with your thyroid. It is good.
Thank you for checking.
You're welcome. We're gonna go ahead and test for your jugular. I'm gonna feel any issues going on. But we don't do this at the same time. Okay, everything is good. Okay, we're gonna go ahead. Sorry, I caught your earring.
Okay.
Sorry. I'm sorry.
It's okay.
Okay, go ahead and shrug your shoulders.
Yes, ma'am.
Okay. And then the supraclavicular node we're going to fill. And then the inferior clavicular node. Okay. Okay. And you went ahead and shrug your shoulders, right?
Yes, ma'am.
Okay. And we're going to have you turn your head towards that. Okay, good. Turn your head towards that. Okay. Now we're going to go back up to your mouth. Sorry. And your lips or look like you don't have any sinus. They're pink and moist. Okay, I'm going to have you touch your tongue to the side of your cheek, and have you touch to your other side of your cheek. Okay, and if I had gloves on, because I would be donning gloves in a proper issue, I would palpate the hard top of his palate. I'm going to go ahead and have you open up your mouth, turn your head back and say, ah. Okay, and then the uvula is responsive. There is erythema and exudate noted to the back cavities with evidence of a tonsillectomy. So exudate, erythema, and a foul-smelling odor.
I'm sorry, I didn't hear you.
Foul-smelling odor.
Oh.
To the back of your...
I have to brush my teeth more.
No, it's not that. It's sometimes with infection from bacteria. Or bacteria can cause odor. Okay. Other than that, we're going to go ahead and listen to your lung sounds, okay? So I'm going to start in the back, and we're going to listen to 6 places in the back, and then I'm going to listen to 5 places laterally on your sides, and then we'll move to your front, okay? So I'm going to have you breathe. I'm going to listen with the diaphragm first. Okay, now I'm going to listen laterally. Okay. Okay, and now I'm going to listen to with the bell. Okay. Since I'm already on the back, I'm going to have you say 99 as I push, okay?
99. 99. 99.
No epiphany noted. Epiphany or phrenatus. I can't think of what the first word is. Something phrenatus. I can't think of it. Like, sorry. Okay.
You got this.
That's okay. Sorry. Let me get it together. Okay. So now we're going to move to the front, and we're going to listen to 4 points in the front, and then we're also going to listen to heart sounds. Okay.
Yes, ma'am.
So I'm gonna do it with the diaphragm and the bell as well. Okay.
Okay.
So do you mind if I get inside your shirt? We're gonna provide modesty for you anyway. So.
Is this okay?
Yes. Okay. So we're gonna go ahead in here. Just breathe normal. I'm just listening to your lung sounds right now. And then I'm going to listen to your aortic. And then your pulmonic. And then your air. And then your mitral. And I'm going to listen to your apical pulsar. We're doing this. For at least 30 seconds, okay? Okay, and I'm going to go ahead and listen to the bell. The bell. Apical pulse is at 77. Okay.
That's a good heart rate.
Yes. We're going to go ahead and, sorry, I got nauseous all of a sudden. Your heart rate was, your heart was regular rate and rhythm. You had a normal pulse to, I would say, 2+, normal.
Were my lungs okay?
Yes. Oh, your lungs were clear. No signs of any type of congestion or consolidation. So, okay. So now we're gonna go. We gotta get it together. Okay. Now we're gonna go from your shoulders. I'm gonna have you lift up your arms. Okay. Now bring them back down. I'm gonna have you bend your elbows. Okay. I'm gonna have you grab my fingers.
Oh, sorry. I apologize. That was...
Okay, grab my fingers, squeeze them tight.
Yep.
Okay, now pull towards you. Okay, now push against me. Yes. Okay, now push up. Okay, now push me down. Okay, good deal. Now I'm going to check your radial pulses to make sure they're bilaterally equal. 2+ normal. Okay, and I'm going to rotate your wrist to make sure you have a good range of motion. Okay, can you move your fingers up and down for me? Okay. It looks like they are cap refill less than 3, no clubbing noted, pink, warm skin, no issues noted, dry. Okay, I'm going to go ahead and I do not have the reflex hammer, so I'm going to use the bell of my stethoscope to do the reflex. Okay, you ready?
That's funny.
Okay, and then we're gonna dingle your arm.
That one was fixing that. Just make me laugh.
Okay, and then we're gonna go ahead and look at your tummy.
You want me to lay down?
Yes, if you'll go ahead and lay down for me.
Are you okay if I bring up my shirt so
Yes.
you can see?
Yes.
Okay.
Oh. Okay. Stomach looks concave, no deformities noted, no lesions or issues noted at this time. We're going to go ahead, since I expected it, we're going to go ahead and auscultate. You're going to listen to the quadrants with the bell and the diaphragm to hear vowel sounds. Listen up to 2 minutes. Okay. We're going to listen with the bell as well. Vowel sounds irregularly regular. I'm gonna lightly palpate. Okay, and then I'm gonna deep palpate. No issues noted with McMurray's. with cholecystitis. Okay. No issues with appendicitis either.
Okay.
I'm going to check for the liver enlargement. Liver is normal within size, and then I'm going to.
You're okay.
I'm going to check.
You're okay.
I'm going to check for the spleen. Spleen is normal and okay. I'm going to go ahead and have you sit up to
Yes,
look at your
ma'am.
stomach. And then I'm going to check for CBA. I'm going to hit your back, okay? Any issues?
No, ma'am.
Okay. CBA negative. Right? Okay. And then, okay, then we're gonna move down. Are you having any issues with your legs at this time?
I've been working out a little bit more.
Okay.
My knees kind of hurt.
Okay. We're gonna go ahead and move down. I'm gonna do the interior and posterior. So we're gonna grab the knee and bring it forward, right? And then we're gonna push, okay, negative, bilaterally, bring it forward, push, negative, bilaterally, move down, no posterior tibia edema. We're gonna check for pedal pulses and tibial pulses. 2+ normal and both bilaterally. Toes are warm pink, cavity flow less than 3. Keely's range of motion is active. Keely's reflex present. Patella reflex.
That was always making me laugh. Sorry.
Patella reflex present. Okay, we're gonna move them on the back and do the appies. So we're gonna move. Oh, okay. Ooh. Okay, negative.
That actually feels good though.
Does it really?
Yeah.
Okay. I'm gonna have you go ahead and walk a few steps that way,
Yes, ma'am.
and I would do heel to toe first.
Okay. Heel to toe.
Yes. Okay, go ahead and turn around and walk back. Okay, and I'm gonna have you stand here and
Okay.
stand and see if you sway. Okay, and then close your eyes. No swaying noted. Okay, now I'm gonna have you go ahead and look forward and bend and try to touch your toes. I'm gonna check you for
Okay.
scoliosis.
So that and touch my toes, right?
Yes, try to touch your toe. Lean straight right. Okay, no scoliosis detected. Okay, and then we're going to I'm going to go ahead and ask you some questions about your medical history, okay?
Just
Do you mind if I sit down next to you? now?
sure, no problem.
Okay. At this time, I'm going to look at my notes to take a peek, just to make sure I didn't miss anything. I'm going to use this moment to make sure. What was the, I haven't looked yet, but what was the 3 numbers that I actually remember?
Good question. I remember. It's 1, 2, and 3.
Perfect. Okay, so I'm gonna have you do the finger to nose test.
Okay.
Okay. Okay, and now I also want you to do puff cheeks. I want you to puff your cheeks out. Okay, and then I want you to frown. Frown for me. Okay. Perfect.
What is this test for?
It's testing to make sure that your cranial nerves are intact.
Oh, okay. Thank you.
Yes.
Appreciate it.
Okay, now I'm going to ask. Oh, and then also, I don't have the tuning fork to do the Weber's and the Reiner's test. But if I was to do it, I would tune it and then stick it on the top of the head, and we're checking for to make sure that they hear the sounds equally for it was for bone. Oh gosh, my mind just went blank. Okay, to make sure this hear the sounds equally. You do it on the top of the head, and then on the other one you tune it, and then you do it behind the ear on both sides to make sure that they heard the vibrations equally in both sides of the ear.
I hear when you do this, I hear like the sounds. That's pretty good, right?
Yeah. So also you do the whisper test where you would whisper 2 inches from the patient.
Ooh, pineapple.
Okay. So I'm gonna sit next to you on the bed to ask you some questions to do an assessment. Okay. Have you you said that you had no other primary. You said that you had no other medical history?
No other medical history. I've had a tonsillectomy.
Tonsillectomy? Okay.
I've had a tonsillectomy.
Is that the only other surgery that you've had?
Yes, ma'am.
Do you take any medications?
Other than Tylenol multivitamins.
Okay.
That's really it.
And what do you have any family history?
So my mom is diabetic. She is type 2. And my dad, I believe he has high blood pressure.
Okay, what about your parents' parents?
So yeah, so my mom as well, my grandma on my mom's side,
Okay.
she's also type 2 diabetic. And my grandpa, he did have prostate cancer.
On your mom's side or dad's
On my
side?
dad's side. Yes, ma'am.
Dad's side. Okay. What kind of diet would you say that you have?
I usually do a really healthy diet. I like to eat oatmeal in the morning and peanut butter. I've been trying to eat more protein, I guess, so I can try to get back into working out and modeling.
Modeling, huh?
I try.
Okay. Would you? It looks like you take care of your nails. Your toes are painted.
Thank you. I try.
So my phone died in the middle of my asking my questions, but I have not pieced together any of the actual assessment that was earlier. So I'm going back to my PMI question or PMH questions, but it literally just died in the middle of it, and I'm lucky it's safe. So here we go. Okay. Hopefully they don't cut me off. Okay. Healthy. Okay. Do you have any type of hearing or vision issues that you've had in the past?
I don't have any vision issues.
Okay.
Sometimes a little hard of hearing, but that's about it.
So hard of hearing. Okay. Ever had any complaints with your neck? Any issues since
No,
you said
ma'am.
that you work out?
Okay.
But you do like to do work. You do like to work out as an activity.
Yeah, I do like to work out. Sometimes my knees hurt just because I do heavy squats, but ice and wrapping it up helps.
Okay. Any psychological issues?
No. Yeah,
No depression, no anxiety.
No depression or anxiety.
Do you have any issues? You said no neck issues. Okay. What about respiratory issues? Do you get upper respiratory infections a lot? Do you have trouble breathing? Do you have asthma?
No, I mean maybe some allergies, but
Like seasonal allergies?
yeah, seasonal allergies.
Any GI issues? Like trouble using the bathroom? How often do you use the bathroom?
Your typical once or twice a day.
Okay.
Like number 1 and number 2.
Both.
One maybe 3 times a day. I drink a lot of water, and number 2 I guess once or twice a day.
Okay. So
No issues there.
is your urine usually clear?
Yeah, it's pretty clear.
There are no issues with burning?
No burning.
And you usually have how many vomit events a day?
2.
2.
On a good day. No.
But no trouble with constipation or diarrhea?
No.
Not usually?
No, unless if I go to a foreign country and eat different foods. It kicks in.
Okay. Any musculoskeletal issues such as like joint pain, trouble, other than what you said about your from squatting, from your knee pain and squatting?
Just really knee strains.
Okay.
And sometimes when I do deadlifts, my back strains.
Okay. Okay. Do you have any complaints with your? I know that since you were a male, you don't have breasts, but the area is still considered the breast area. Do you have any issues with that? Any like lymph nodes or anything that you're, or swelling or nodules that you were concerned about?
No.
Okay. Any heart issues in the past?
You said heart issues?
Mm-hmm.
No, I don't think so.
Okay.
No heart issues.
No fast heart rate, palpitations. Do you drink energy drinks?
I don't like energy drinks, and I only get the fast heart rate when I'm like doing cardio. Okay. But it goes away when I relax or stretch.
Okay.
I like to do yoga sometimes too. Calms me down.
Okay. So you use yoga as meditation? Would you say?
Yeah.
Would you
Mindful
say that?
meditation. I think it's nice.
Okay. Have you ever been told you had any endocrine issues? You have any random weight gain or
no random weight gain?
Increased appetite?
No, not much loss of appetite. I did get tested when I was a kid for pre-diabetes.
Okay.
But I started working out and I didn't hit diabetes.
Okay.
I changed my lifestyle a lot.
Do you have any issues with your reproductive system?
Just no, not really.
Okay. Are you a smoker?
No, ma'am.
Are you a drinker?
I've been doing a couple of White Claws 2 times out of the week.
Okay.
It's like 100 calories on only 2 grams of sugar, so I don't feel too guilty drinking.
Do you, are you sexually active?
Yes, ma'am.
Are you married?
No. No kids, but hopefully I can adopt in about 5 years.
Okay. Do you have the same sexual partner?
With the same person, yes.
Okay. Are you concerned for any STD checking at this time?
Not at all. For my sore throat, what medications do I get?
So what we'll do is we will probably we will swab you for strep throat.
Yes, ma'am.
And if it comes back positive, even if it doesn't come back positive, because we'll send out, there'll be 2 tests. We'll do a rapid and then we'll do a long one, because sometimes that one can come back positive.
Okay.
We'll go ahead and probably give you a Rocephin shot and then send you home on antibiotics.
Okay. Like penicillin's pretty helpful for me.
Yes, and then if you have like any issues like a nausea or if you're having like any like congestion issues that come up like later on, or like your ear starts becoming any problems, sometimes the antibiotics will help both of those things. But you can always come back and we can always prescribe you some other medications if you need to.
Awesome. Thank you so much. I appreciate it. Yeah. So Tylenol, Motrin.
Tylenol, Motrin for the fever. And then you can treat the symptoms with over-the-counter medicines, but we will give you antibiotics to help you get over the strep throat if that is what it is. And if it isn't what it is, the antibiotics will still help clear up any, because it does look like it's more bacterial, so it will help clear up anything that is going on there if it's not strep throat. Okay. But we will call you and let you know.
I like a follow-up.
If it is strep throat or not.
Got you. Okay. And I'll take it for 7 days, right?
The antibiotic we were prescribing, yes.
Okay, and twice a day, right?
Yes.
Okay, just making sure.
Okay.
Okay, thank you so much. I appreciate it.
Well, thank you. Come back.
Yeah, thank you.